Very good afternoon to everyone present here. I Spurti Shetty, Research Assistant at Manipal Health Literacy Unit, Prasanna School of Public Health, Manipal Academy of Higher Education, Manipal, Karnataka, India. It is my honor to welcome all the participants from 13 different countries to get benefited of the first webinar organized by Manipal Health Literacy Unit in collaboration with Asian Health Literacy Association. MHLU aims to excel in health literacy resources, policies, and practices. The Asian Health Literacy Association seeks to understand health level across Asia from a research, educational, and policymakers' perspective. Collectively, MHLU and ALA are initiating webinars on health literacy for healthcare providers, community researchers, and policymakers. Now I take this opportunity to introduce first speaker of today's webinar, Dr. Usha Rani, Coordinator, Manipal Health Literacy Unit. She has completed 50 plus projects and organized 25 plus national and international conferences and workshops in healthcare. She is working on various health literacy interventions, certificate courses, webinars, projects under MHL. She is currently working on funded project Health Literacy Database. Dr. Usha Rani is instrumental in initiating membership drive under MHLU to spread the concept of health literacy both on national and international level. She is representing Indian Country Office Head for Asian Health Literacy Association. Now, I would like to request Dr. Usha Rani to introduce us the concept of health literacy. Over to you, ma'am.
Thank you, Spurti, for this nice introduction. Welcome again to the audience over here from different countries. Let me introduce you the topic of health literacy from the researcher as well as a layman perspective. So in this webinar of my presentation, I'll be talking about what is health literacy, how one can assess health literacy, is there any domains or disease-specific tools for health literacy, how to improve, and what is the possible impact of health literacy for a country. So when we see the concept of health literacy was started many years ago, in around 1960. And in 2004, Institute of Medicine came up with a definition called as health literacy is individual's capacity to collect, process, understand, and synthesize health information. And based on that information, health information, take the health decision based on its ability. Whereas Nutbeam's definition in 2000, which is very famous and many of the researchers have quoted his definition, is the personal, cognitive, and social skills which determine the ability of individuals to gain access, to understand and use information, to promote and maintain good health. Christine Soresin article in 2012, they did a systematic review and compared various definitions, and they came up with a newer definition where they have appraised that a person's ability to access health information, understand health information, appraised whatever the health information they have understood, and then apply it not to themselves, but also to their family and near ones. So in a nutshell, I could say individuals' capacity on health information to collect, process, understand, and synthesize the health information and then take health decision for themselves and for their community and nearby is health literacy. This was a definition which was used till last year. There is a newer definition which has been proposed. The personal health literacy cannot work alone. It has to be in line with the organization health literacy. So organization health literacy has an equal responsibility to ensure individuals' health literacy capacity development. So they said individuals' ability to find, understand, use information and services to inform health-related decisions for themselves and for their family, and then take actions for themselves and others where organization has played a varied role. Organization means the health delivery organization role in delivering all this health information to the individual so that the individual is able, an individual is called as health literate. The next question comes is how to assess health literacy. So when we see there are 217 different forms of tool in different languages, and they measure different aspect. It can be categorized as health literacy domain measure, specific context, population, age, and languages. So collectively there are total 67, which are further classified in 217 categories. What these tools are targeting? Some of the tools are targeting numbers. For example, medical terminology, they are explaining, they are asking about a individual's capacity to identify the words. For example, diabetes, hypertension, cancer. What do you mean by those words? Calculation, again going critical thinking, various case instances has been given, and where the person was asked to think about and come up with a decision, and so on. Comprehension and media literacy. So this kind of tools are there to assess individuals' health literacy. When we say the organization has an important role to develop person's health literacy, how they do it? So it is expected that a patient or the family member of the patient, whenever they visit the hospital or the healthcare provider, they're supposed to communicate about their disease. They're supposed to inform in detail about the disease burden or disease that the patient is carrying. The communication plays an important role. Listen, listen to the person who is there in front of you. It could be a patient, it could be a family member, it could be a relative, it could be a friend. So healthcare providers' role is to listen to the complaint or to the issues that a person is bringing in front of them, and use a teach back. So healthcare provider is giving them information, for example, on diabetes, and then ask them back, what have you understood? Can you tell me what do you mean by, if I say one a piece of this kind of meal you can eat, what do you mean by quantification of that meal, and correct the health information. Now sometime healthcare provider has told, okay, you can have one sandwich or a one burger a week, and that does not mean this kind of sandwich or a burger that they can have. So there comes a different methods or different approach to deliver health literacy that are classified as traditional method, art-based method, interactive learning-based interventions. So there are different forms of interventions which are tried and tested by the researchers that helps to develop individual as well as community health literacy, so that the person understand and is able to apply the health information that they have got. So it can be didactic lectures, distribution of posters, chalkboards, projectors for teaching participants, or maybe showing the picture cards, what they can, what they cannot, or telling a story. For example, a child is scared to going to a dental clinic, and telling them a story how you visit into the dental clinic and what is going to happen, and it will not be painful, but with the help of interactive infographics and pictures and interactive books. Group discussions can happen in a community level, peer support can be initiated, and simulation games, that also plays a very important role in health literacy, and which is coming up as a very big field, and various apps. So based on what we have discussed, that there are tools to assess, there are methods to improve and the individuals as well as community health literacy. So do we need extra resources to develop health literacy of individual as well as community? No. What we need is just channelizing whatever is existing. Collaborate, activate to deliver health literacy interventions. We already have education providers, primary healthcare providers, healthcare industries, and various industries. If we partner together, we can always activate the channels of health communication with partners. We can follow up with the partners and find out what is the level of health literacy of their stakeholders. It can be, their patients, their employees, or whomsoever. And once we know what is the level of health literacy, we can identify the gaps and map the effective health literacy intervention with those gaps and apply the optimum, the appropriate health literacy intervention, rather than hit and try, trial and hit method, where we don't know whether this intervention will work or not. Once we know that, okay, this is the gap, so this kind of intervention will work to fill this kind of gap. What is the possible impact of health literacy implementation program for a country? It can be classified as primary and secondary. Adherence to the medical advice will improve. If the patients are health literate, they will understand how many tablets, how much, how frequent will happen. Decrease in outpatient load in neighboring tertiary care hospitals, because tertiary care hospitals are overloaded because patient doesn't know what they're supposed to do. They reach in a very critical situation to the tertiary care hospital. So they will not reach to that level. Increase in practicing healthy lifestyle and health literate community. Secondary impact will be reduced number of sick leaves by the employees. So definitely economy boost will happen. Improvement in various health indicators, reduction in sickness episodes due to avoidable causes, and country's economical growth. So if collectively we implement health literacy interventions in metro cities by 2025, we are able to reach to villages by 23, there is going to decrease the healthcare cost to the country, and which in a longer run, which will provide us healthy country to contribute economical growth. To summarize my today's session, health literacy helps in individuals informed healthcare decision making and is a collective effort by an individual and various organizations. There are various tools to assess health literacy. There are tried and tested interventions to improve health literacy. Health literacy development do not require additional resources, but directs the resources to identify and fill the gap. If health literacy is developed at a state and national level, it can reduce the burden of disease and can contribute in economical growth. So thank you so much for giving me an opportunity and presenting this piece of work.
Thank you, ma'am, for educating on health literacy and its various components. Now, I would like to introduce our second speaker, Professor Dr. Peter Kushan Chang, who has received his MD degree in 1984 from National Yangmin University Medical College, Taiwan. His master degree is in public health with major in environmental and occupational health. Professor Peter Chang extended his interest in global health and established the Asian Health Literacy Association, the ALA, since 2013, also served as a president of ALA from 2019 to 2022. Professor Chang has made many contributions in the field of health literacy. He was a senior global health literacy advisor, International Center for Health and Developmental, Switzerland. He is a member of editorial board of Journal Health Literacy Research and Practice, also in the Journal of Nutritional and Food Science Forecast. He is also a fellow scientist in National Health Research Institute, Taiwan. Now, I would like to invite Professor Dr. Peter Chang to help us to learn more on field of health literacy for better health services. Over to you, sir.
Thank you so much. Good morning and good day and good afternoon, all friends online. And thank you, Sporty, for a very comprehensive introduction. And I also like to send my appreciation to Usha in India regarding Open Up and organize this very important webinar series, ACLA, in 2023. It's Open Up, very important engine for our ACLA, the series of our colleague to launch and move health literacy in Asia around. Particularly, I appreciate our new leader, Professor Angela Liang. Congratulations to her to leading the ACLA to a new stage. So I'm very honored to offering the next 10-15 minutes about how health literacy can work for better health service. And particularly after Usha already opened up the platform. Health literacy has many functions. I cannot tell you all but the following will be some of my reflection and my perspective that for ACLA and working on health literacy in the past dozen years. And you see that health literacy has special interest in moving the equality of health. And this is a little myself that I'm working in Sichuan healthcare system at this moment, but I'm serving in ACLA and IHLA as well as in TAF, and which is some of my function and capacity in the past. If I can have the next slide. Thank you. So I'll be straight and frank to tell you and some of my thought about how can health literacy help, right? If health literacy is important, it's good, but how can that be useful? And these are my my quote for health literacy. Health literacy prevents disease because health literacy helps people to take active prevention actions and preventive measures, particularly like vaccination, etc. So health literacy is good for the people. They can prevent disease. That's important. It will reduce a lot of waste and the discomfort of your life. The second, health literacy help recover from illness. People get sick off and on, and often that they have difficulty when they got sick. But if they are equipped with good health literacy, they will recover. They will communicate much better in their ways with the healthcare providers. So if we equip people with good health literacy, they can help them recover from illness quickly, more effectively, without too much suffering. There are other benefits of health literacy. Health literacy secures health professions' achievement. Sometimes as a healthcare profession, most of us, we try to help the patient, we try to help the family of the patient, but sometimes we don't have a good tools, right? But if we can equip with the patient with a good health literacy, we achieve our profession achievement. We can get satisfaction in our profession. So I think health literacy also helping healthcare providers. And finally, health literacy enhance effectiveness of healthcare service because we are having better communication with the patient, our client. Healthcare provider are taking action, more effective action, and working in partnership with the patient. So these are my quote. I hope this will be proved when you practice health literacy in your career. Next slide, please. Okay, health literacy are everywhere. It's in our daily communication between healthcare provider and patient. Without good health literacy, usually we will get misunderstanding and misinformation. For example, a lady doctor tell this patient, said, "Oh, you got chronic renal disease." Well, this chronic doesn't mean the same between healthcare provider. You know, we use the term CKD, but for the patient, they feel like they are determined, their life is short. So this is misunderstanding, and there are also a lot of misinformation surrounding when we communicate about healthcare information. So health literacy are essential every day. Next slide, please. Spotty, yes, and they are everywhere. You see, this cartoon shows the lady doctor said, "Okay, this is your waiting area," and you see a lot of patients they have to wait to receive a good healthcare service. So this guy just said, "I would be better be camping around the hospital." Well, actually, in many parts of the world, I know patients they are camping inside the hospital on the corridor because they are not so sure when they can receive the health they need. So uncertainty without good health literacy create resistance and trust, and we are losing whatever we are offering. Next slide, please. And patient waiting time is one of example of these health literacy difficulties. You know, they are overworked the doctor everywhere, and nurses they are complaining. But patients even complain more. The waiting time usually is one of the example of our, you see the example in Thai on the left and example in Taiwan. This waiting time, people are losing their health. They cannot recover. They are healthy, and they are waiting their time in order on the line to get assistance effectively. That is the difficulty of health literacy. Thank you. Next one, please. So we have a lot of occasions like this. This lady has a heart problem, chronic heart failure. The medicine has not been created to be friendly, right? They create this EKG on right-hand side. We have seen this kind of EKG for many, many days. I think EKG come up with more than 60 years in the medical history, but it's even for many of patients. They have no idea what does that mean. It doesn't look like their heart. This EKG only means something to healthcare provider, not the patient. And very difficult for the patient to understand what does that mean to them. If I can have the next slide, please. And there are even more examples like people will find this is a famous actors in Taiwan. He got a lung cancer. He passed away. Very famous. And he has been taking chest X-ray frequently. And this kind of chest X-ray been over 100 years. We have very difficult situation all the time to tell the patient, what does that mean, that little opaque shadow, big and small? Well, doctors can communicate easily, but very difficult to communicate to the patient. Next slide, please. And if patient doesn't understand, how can they benefit from this medical achievement or medical service? So this is another my quote. To most of people, medicine is a mystery, right? That's the reason we spend many years trying to learn medicine. But when people got sick, this mystery is killing. This mystery make them distant from life-saving strategies. So that is a big problem. Next slide, please. For many of us. And we also looking for a good doctor. This is the example. Most of the time, doctor having learned a lot of medicine information, what they express is very difficult for the patient. And usually we see, I don't know, it happened in Taiwan and many parts of the world. A wise doctor once write this. I mean, we cannot tell how wise this doctor, but usually these big doctors, they communicate something. It's not easy to interoperate by new terms. Next slide, please. So this is the USA study. 90% of the people lack skill, need to manage health and prevent disease. Majority of the people, regular people, do not have such skills. Next slide, please. And it's not only in North America, it's happened in Europe. And a few years ago, European Health Literacy Survey proved that 6 out of the 10 people, Europeans, have used the internet to retrieve health information, and 1 of the 2 is having a challenge regarding health literacy. So it means that in average, half of the people in Europe do have no adequate skill to understand what the health information means to them. We can tell some of the countries are showing pretty good, Netherlands, but some countries like Bulgaria and Spain, Austria, having without adequate health literacy in most of general public. How about Asia? Can I have the next slide? We compare some of the countries, 6 countries study that you see that in the top is the 8 countries in Europe, and the low down we have Japan, Indonesia, Myanmar, Kazakhstan, Vietnam, Taiwan. In general, Asian health literacy in most of the countries are lower, are not adequate. For example, in Taiwan, even we have a pretty good healthcare service, quote, and we still have a 20 or 30% of public, they do not have satisfactory skill to handle, to understand the health information or to manage their health problems. And some of the countries really have catching up. I know, for example, in Vietnam, they are trying to catch up very much. Indonesia is also, and many others. I think this is very important to know what is the problem ahead of us. If I have the next slide, please. All right, so this is my last one. And again, thanks to Usha, opened up a definition of health literacy, how function cannot be. But I see health literacy is not just a dictionary, it's the name. It's evolving, it's an evolving subject. We have to put more energy into that. So health literacy is essential for effective health service. You know, it's more than users are putting in big expensive machines, or you provide expensive building or sophisticated medical skills. Without health literacy, all these services are less effective as they are expected. Health literacy is saving times of the people, not only the patient, but also the healthcare provider. They save lives. They tell people how to come to effective right time, right place, and right problems to their health. And they are essentially saving money. That's important. And many studies showing 10 to 20% of the money can be saved if the public or the recipient of the healthcare can be having equipped with good health literacy. Now, number three, health literacy evolve in different perspectives. It's not easy. I'm still learning after 10, 12 years on the health literacy. I'm still learning every day in every part of my my working environment. I'm seeing as a clinician, I see patient, and I'm learning how health literacy can help these people, the patient. And number four, health literacy is a model for, I'm sorry, this is, okay, I have been covered with, yeah. Health literacy should be a motor and for health service. This is mistyping. So finally, AHLA aims to promote health literacy in all different ways for everybody, for all the country, and actually health literacy work in all the communities. And for every family, every patient, I experienced my loss of my mother in the last few years. And when I was staying with her in the last 6 months, I was learning health literacy can be really helping the old lady overcome the most difficulty of her life. So health literacy really helped. And I hope we can work together on promoting health literacy between us and in all the communities, and we have a lot of work to do. And thanks for this occasion to share with you, and I could learn from you also. Thank you so much.
A very big thank you for Dr. Peter speaking on health literacy for better health care services. Now, I would like to invite Professor Angela Y.M. Leung, who is a professor and associate head in School of Nursing, Polytechnic University, Hong Kong, China. She is the president of Asian Health Literacy Association. She is an active researcher in health literacy and dementia caregiving with wide range of publications and international journals. Now, Professor Angela will guide us through discussion and question and answer session. Over to you, ma'am.
Thank you, Smarty, for introducing me, and this is my great honor to be the discussant here. So actually, I'm taking up some very important role because in the next 15 minutes, I would like to invite everybody to join the discussion. As Smarty has mentioned, that I am the president of the AHLA, so I have the responsibility to make everybody to know about health literacy and be excited about all the work that we have been doing in health literacy, and we want to collect the wisdom from everyone around the world to know about, to work together on health literacy. Okay, to start with, maybe I could pose up one or two questions to the two speakers. I think the two speakers have been doing well today to introduce that, like Dr. Rennie, she mentioned about the personal health literacy and organizational health literacy, which are two different levels, and there is a trajectory over here. In the past, we do focus a lot about personal health literacy, but more and more work has been done, and then we find out that organizational health literacy is also important. So can I just get the wisdom from Dr. Rennie that what could we do and how could we start with such kind of development of the organizational health literacy? I think this is very challenging. Many staff are in the organizations. Where should we start?
So thank you for your question, Professor Angela. It's a very important and wonderful questions, because As we discussed in the definition part, now we have moved from the personal health literacy to organization health literacy. So the responsibility lies not only with the individual, but also with the organization. So it should start from the top-down approach. So top-level management, once they understand the importance of health literacy, they tailor-make their policies and the protocols, ensuring that not only the patient, but also their employees and all the stakeholders has an access to the right health information. If they have a doubt anytime about that health information, they can reach to whomsoever and they can raise a query that they want more information to gain more insight on that particular topic, gain more information on the health for not only for their personal, but also for their nearby and dearby. And what happens once the organization is committed? So there are all the activities, communication activities. They give more time to the patient. They ensure that the doctor has more time with the patient and doctor is able to use the teach back method or any other method to ensure that the patient is gaining the health literacy. So organization plays a very important role. There is no doubt in that. And I have added one more component. It's not only the healthcare organization. Every organization plays an important role. Let it be a service or a production industry, because every individual has a health associated with it. And every individual has a right to know about their health and to be health literate. So thank you.
Thank you. Thank you for sharing your views on that. Professor Peter, do you have any views on the organizational health literacy? Do you think that there is something that we can work together on that?
I think that, health literacy, if we say that saving life is time is life, and it's saving time is money also. I used to say that health literacy is a good investment, that people increase their health literacy. It's like you invest your treasure, your financial capacity. So before we used to say individual health literacy means how much money I can save in my pocket, right? But now, just to saving, put in your under your pillow doesn't help. We have to share. So if I share my health literacy with Usha, we become a trust. There was a lot of trust. So sometimes Usha has a lot of health literacy she can share with me, which I need. So it's organization. It's not just one person with a healthcare provider, with one hospital. It's as a group. So I usually say that health literacy influenced very much by a family member. If you have a very good father, mother with very good health literacy, usually the kids are getting born, not just born, but also be a lot of high health literacy. So I think organization health literacy is not only one individual, but not just one family. It's a society. For example, a school, a university, a city, and which is all shared. If you look at how financial structure was working, actually, health literacy also working like this way. So I think we don't worry. We just keep our health literacy within ourselves. We share that. The more we share, everybody having this health literacy organization is helping everybody, every individual in the society.
Yeah, I can't agree more. To be frank, by the time when I start with the health literacy in Hong Kong, one of the most common questions that I receive is that, are the patients ready to talk to the professionals? But on the other hand, I'm also asking, are the professionals ready to give room for the patients to talk? So organization may play a very important role to give rooms for everyone to participate in this kind of health communication, and also give some empowerment to the patients to do something about their own health as well. I'm sure the audience today may have a lot of views on organizational health literacy or some of the views on personal health literacy as well. You are welcome to put your notes in the Q&A, your comments in the Q&A. And if you have further questions, please feel free to put up the questions in the Q&A section so that the speakers can also read your questions and we try to answer as much as we can. All right. I think here the professionals have something that could be done. I'm also thinking about that the policymakers as well as the administrators of the health organizations may have to play a role here as well. So do you think that these people can do anything? And I'm thinking also some other disciplines like the physiotherapies or the occupational therapies. Are they all ready to work together for health literacy? Maybe you have the quick answer first, and then we follow by Professor Peter.
Yeah, thank you for this question. So I always appreciate that the professionals should know the local dialect. So many a times professionals fail to understand the local dialect and local language. And what happens, the patient come up with one problem and the solution is given something else. That creates a lot of gap. And if the professional itself is a health literate, from the context of the localites as well as the local will gain a lot of information from the professionals. Then only this gap can be filled up. And definitely all these allied health professions, including physiotherapy, occupational therapy and all, they have a very important role in playing health literacy, contribution to the health literacy.
Thank you. Thank you for your comments. And Professor Peter, do you have any views
Maybe
on
also,
this?
actually, when I was discussing health literacy or share discussion health literacy with my colleague, actually, most of the time is the physicians, because they give me a lot of doubt about why they need to share this health knowledge with the patient. They say that they put it very simple mind, say that, well, if all the patients know how to take care of themselves, I have no patient. And I think, well, I don't want to talk about it selfish, but it's a traditional way. Is the doctor was the dogma, is the king he is giving up. But this is not. This is the healthcare service is not like that any longer. In order to provide, if all the patient can keep themselves, the doctor or the hospital really having good time, right? You don't need too much change of your parts or that, right? They are working with you in a harmonized way. Nowadays, if we talk about business, we want to keep our client come to us regularly, stably. We don't want any accident. We don't want some urgency or something, right? So that's the way, a healthy way of healthcare system. When I talk about healthy way, healthy system. So I think the sharing, and because I see when the patient are having higher health literacy, it's much easier for healthcare provider to take care of the problems, right? So we have to change this idea and this direction further.
Yeah, maybe probably the professionals should be the first group to be trained about health literacy. I totally agree. Because when the professionals are not quite ready, there is no room for the patients to really ask questions. So that's why there is a very important message is about teaching the patients to ask 3 questions in front of professionals. That is a called Ask Me 3, right? That there's an Ask Me 3, that particular very precise questions that can train up the patients to ask the professionals what kind of things that I could do, what are the benefits of doing that, and what are the possible consequences if I don't do it. So I think these kind of 3 questions are very simple that can arouse discussions between the professionals as well as the patients. And again, are the professionals ready to receive these kind of questions would be another big challenge to us. So maybe the policy in the organizations, that is the organizational health literacy, would be something that we may like to go for, and asking the policymakers and administrators to do something about that. I know Taiwan has a very good practice in the hospitals that if they want to get accreditation, they must be health literate organizations, right? So Professor Peter, can you share something about that?
Yeah, I think it's kind of the health literacy. Slowly we disseminate to all the hospitals and through accreditation system. Taiwan's health accreditation system has a very strong power because it's regarding the financial reimbursement. So a hospital is shown with a higher health literacy or higher shared decision making, higher patient engagement, patient has a higher satisfaction, they got a higher accreditation label, and they paid much better. So in this way, it's a positively that we are helping a patient, as much as we could, and we got a very positive response from all this financial feedback. So I think this also happened in many other countries, and not only in Taiwan. And I see slowly, so it takes several years. Understand that when we are doing this, it's not easy in the beginning. The beginning decision making, the top one usually say, "Oh, why should I share all this critical information?" Now they changes. They want the patient be empowered to be engaged more, and they got a very good encouragement.
Yeah, yeah. I think India, is that right? That you sure that Indian government is also planning something to promote health literacy as well? Can you share something about that?
Yeah. In 2017 onwards, the government has started, identifying health literacy as one of the key components for the health development. It has already started some of the measure. It has a website where they provide the health literacy information for the public to access, and they have started many projects and initiatives. So government is definitely, contributing directly and indirectly for the development of health literacy.
Right, great. Yeah, I think same to mainland China as well as Hong Kong. As far as I know, the government has been putting a lot of efforts to make everyone to be health literate. Like Hong Kong, the government actually put up a lot of money to support the development of some interventions to help individuals to build up their capacity, in particular, digital health literacy. So maybe later on we can have some experience sharing as well in the future to talk about how different countries are working on that. I know that some of you may have some comments, questions. If you don't want to type your questions or comments in the Q&A section, would you like to raise your hand and you can open up the mic so that we can hear from you? Is there anyone that would like to say something here? Just turn on your mic. Oh, okay, I can see. Oh, is that Carmen?
Yes.
Carmen. Hi, Carmen.
Hello everyone.
Hi.
Thank you for your great inputs. I have a question about organization as health literacy. One of its components is effective communication by healthcare providers. I think there's no argument that it is an effective approach, no, to effectively communicate to patients and clients of health service facilities in order to improve individual health literacy. But from the practical point of view, we know that it will take time. It will probably double or triple the amount of time that a private physician will spend on each patient. So that's going to lengthen the period of consultation or interaction. And for public patients who are availing of services from the public health sector, the reality is that we have a long line of patients who are waiting to be served, patients or healthcare clients. So I know that Taiwan, Peter, they have a great approach on this, but for developing countries, where human resource is scarce, what would be the maybe what would be your suggested approach to address this practical issue about doubling the consult interaction, the time that the healthcare provider will spend with the patient? Thank you.
Thank you. Thank you, Professor Carmen. Professor Carmen is from Philippines, School of Public Health. Professor Peter?
I think the patient empowerment or encourage patient organization are essentially important, because if we look at the struggle between the power and the resources balancing, we need to empower the patient. And I already mentioned about some example, doctor, if they are too powerful, they are not interested in sharing these resources with others. And that is the problem. So for some of some country already going to the national program like Thailand, Philippines, you are already on in a good way. The government feel like they want to, most of the government in developed countries, that if they find they can save money, they will do it, right? But before they can make such an important decision, patient engagement, patient empowerment, patient organization, I think is essentially important, because then people can have a group learning, right? If I can learn too much, but 3 of us can learn a lot more than we can do. So I think for India, maybe you already done that. I know some of the civil society has working on this very, very strongly. So I guess that's another way to making health literacy group up root in the society.
Yeah, I would like to add here to Professor Peter's comment. The infographics. Professor Carmen, before the language was evolved, people used to use sign language, and infographics is such. So irrespective of, whichever language or dialect the patient speaks, the infographics gives a very huge information. For example, we all have faced during COVID-19, just wearing a mask and keeping a space, that infographics were working. And it's an investment. I agree with Professor Peter's comment. It's an investment for the betterment of the health. And we should appreciate that.
Thank you. I can see the questions. Somebody is raising their hand. Dabinjani, can you turn on your mic? Is that Dabinjali?
Yeah, it's Debanjali Jairam.
Okay. Can you turn on your mic? Yeah. Sorry, we still cannot hear you. Can you unmute your mic? Dabinjali, we still cannot hear you. And I try to turn on your mic as well. It seems that your mic is not working very well. Okay, how about you type? Yep. And
Angela,
I can read the message.
Angela, excuse me, this is Carmen. We can find the question and answer box. Is there one?
Oh, okay, right.
There's none. That's why. Yeah.
No. Dabinjali, please unmute. Is our moderator to ask her to unmute? Okay. Sorry, Dabinjali, we cannot hear you at the moment. So, but we welcome your questions and comments. But because of the time, I'm aware that we are now running out of time. But I just want to welcome everybody to continue this kind of discussion about health literacy. And I'm sure that we have a lot of opportunities to meet again. So maybe I have to take the opportunities to thank the two speakers, Dr. Usha Rani and Professor Peter Jain, today to share your wisdom with us in the webinar, in the very first webinar that we have. Actually, we will have the monthly webinar, and that will be the first Friday of every month. And then we would like to see you all again next month so that we can have more discussion about health literacy.